But now I want to introduce our panel and have our faculty members turn on their cameras. So you've already met Professor Susan Koch-Weser. We also have Michael Bradley Siegel and Wenhui Feng, all here to take part in the faculty panel. But I wanted to go ahead and give you all a quick chance to give a quick introduction. So I'll start who's immediately next to me, which is Michael.
Well, hi, everyone. I'm Mike Siegel. I'm relatively new faculty here in the program. My research areas are in the areas of tobacco, alcohol, and firearms. And what really brings those areas together is my interest in examining the influence of corporations on the public's health and finding ways to fight these big corporations that have strong lobbies and strong political influence, and figure out how to bring them down. So that's kind of what ties my research together. And my teaching areas are mainly in the areas of health communication, social marketing, behavioral science, and public health. So welcome and congratulations on your admission here. I'm looking forward to getting to know you.
Thank you, Michael. And next we'll go to Wenhui.
Thank you, Jonathan. Hi, everyone. My name is Wenhui Feng. I'm relatively new, but not quite new. So I joined right before COVID. So within COVID years, feels long. So I feel like I've been here for a long time. My research interest is on food and obesity policy. And what really motivates me is that the more I study these issues, the more I feel this is a poverty issue. So it kind of stems that into also the tobacco control areas, as it was a more generic issue and more geared towards the problem that is really burdening the low-income communities. So I'm interested in studying especially state and local level of the policies. And as my interest is for the lower income communities, some of the social safety net programs are my interest too, like for example, food stamps or SNAPs and Medicaid and things like that. In the teaching, my teaching in our department mostly focus on the policy side as well. So I teach public health action, like Susan introduced earlier. This is one of the required courses, very hands-on and skill-based. I also teach health economics, just applying different types of economic theories into practice, how to use those. So I look forward to meeting more of you and chat. Congratulations, everyone.
Thank you, Wenhui. And now, Susan, like I said, if you were to do a quick piece out, I can't remember if everything was integrated into your previous piece or not.
Well, I guess since everyone's talked a little bit more about their areas of research and the work that they're doing, my current project that I've been working on for a while is developing labels for beer that will help consumers make choices, consumer guidance labels for beer. The other project that I've been working on for a number of years with colleagues is a decision-making tool for patients with end-stage renal disease, older patients with end-stage renal disease. And that ties in very much with my health communication and health literacy interests. You may or may not know, and I don't want to go into terrible detail about this, but for older patients, whether to go on to dialysis or not is really preference sensitive. So the difference between conservative management or dialysis is not great in life expectancy, but it's profoundly different in what the remaining life looks like. And yet many patients don't realize that there is a choice. And so the project is very much about how do you educate patients in a way that they understand that there's a choice to be made and that they are, if they want to, able to participate in that choice so that they have less decisional regret for the treatment that they chose. And it really sort of encapsulates a lot of my interests in health literacy, which is we have so much research and we have so much insight into health, but how does the average person make sense of that information and be empowered to take care of their own health and make choices for themselves and their loved ones? And that's really what's strung together all of the projects that I've worked on throughout my career.
Thank you so much, Susan. So now, like I said, we want to jump into some of the questions that were submitted earlier, and some of them we've kind of brought together as they were somewhat similar, but hopefully we'll touch base on the things that you had questions about. And of course, always feel free to put additional questions in the chat. But the first one I'm going to actually skip down to the second one because I've had Susan talking for a while now. So I'm going to go to the second one and direct it towards Michael. Do you have any advice on how to best work with faculty over a student's time in the MPH program? And what opportunities for research have you seen with faculty and opportunities for RA and TA opportunities?
Well, thanks, Jonathan. One of the things that is, I think, somewhat unique about the program here is that the faculty really love to interact with students. We love to not only teach, but we also love to involve students in our research. And there are lots of students who are working with a lot of the faculty members. There's a number of ways that you can do this. There's three basic mechanisms. We have there's first of all something called a directed study, in which you identify a faculty member who will then supervise a project that you essentially come up with on your own, and they will just serve kind of as a mentor for you and guide you through the project. And that's a course credit bearing, just like a regular class. A second mechanism is the ALE, the Applied Learning Experience, and you can do that with a faculty member, especially if your interest is kind of pursuing more of a research track. You can do independent research with a faculty member, and that can be your ALE experience. And then the third is just having students work with us on research, either informally as just essentially internships, or if you're lucky, many of the faculty have research grants that can fund a research assistance. And so a number of our students are able to work on faculty research projects and actually be paid as staff if there's funding in the grant to cover that. So there's a number of ways you can do that. I just thought, just to kind of give you a flavor of this, I just thought I would kind of give you a quick rundown on the students that I'm working with this summer. So I actually have 10 students I'm working with this summer. And just to kind of give you a flavor of it, I have 5 students that are working with me on a project on structural racism. We are actually calculating structural racism indices for all 50 states and every county and every city in the United States. And we're going to publish this as kind of a report card on where each of these cities stands. And I think it's going to have pretty important public policy implications. I have another group of students that is working with me on studying gun culture. We're interviewing gun owners, and we're trying to identify where is the common ground between gun owners and non-gun owners, so that we can propose policies that will be accepted by both sides. And as you know, right now, the last 2 weeks, there's been a tremendous amount of coverage of this issue. And so I think there is a will to try to really do something about that now, and this work is going to contribute to that. And then I also have a student who is working with me on a alcohol brand survey. This is as a independent study project, and she's going to design a survey and try to look at what kinds of alcohol underage youth are drinking. So she's going to go into the schools and probably at the undergraduate level and see what are young people drinking who are underage. And how has that changed over time? And is it related to the marketing practices of alcohol companies?
Thank you very much, Michael. So now we'll move on to our next question, previously my first question. Students must select the concentration at the beginning of the program, but are there opportunities for students with multiple interests or are there opportunities to collaborate across concentrations? And can students change concentrations? And so I want to direct that to Susan.
Well, so I think I touched on this earlier. What I will add to what I said before is you do pick a concentration, and the concentration consists of 3 to 4 additional courses. But you also have 3 to 4 credits, the courses that are elective credits. And so one of the things that we say to students is that the requirements from another concentration make great electives. So you absolutely can pick the concentration that's closest to your heart and dabble in your second choice while you're in the program. You can also, well, I think that's the main piece there. As for changing concentrations, there are concentration required courses, and the longer that are offered not every semester. So in your first semester, it's very easy to change your concentration. If in your first semester you primarily took core courses and maybe just 1 or 2 concentration courses, it's still pretty easy to change your concentration in your second semester. By the time you get to your third semester and you have more concentration requirements under your belt, it might be a little bit more logistically complicated to change your concentration. That said, from a program perspective, we don't force you to stay in a concentration. And if you've chosen one now and you're not sure about it, there would be no reason to have to completely figure that out before you arrived at Tufts. You could arrive, take some classes, look at what's going on, and you would have time to make a switch. If you're sort of thinking, oh, I picked one, but maybe I really should have picked the other, you can figure that out in your first semester and nothing terrible is going to happen.
Thank you so much, Susan. All right. So our next question I'll pose to Wenhui. What is the coursework like, and how is it different from maybe students who are fresh out of undergrad who haven't experienced this graduate level work?
Yeah, a great question. One thing that really stood out is that we have a lot of project-based works in assignments, so in class and out of class. So they really start to think about a skill-based geared towards the skills, right? So we do things like needs assessments, logic models, survey instrument analysis, and the kind of skills and the type of the deliverables that public health professionals produce every day in their jobs. So that's what we really put in a focus on. And in that sense, we do not have a lot of exams in our program. So that's one thing that really jumps out to me. The other one is that our class size is rather small. So we try very hard to cap our classrooms at 40 people. Sorry, 20 people. Oh my God, 20 people. So there's no big lecture hall courses and where the faculty members will not remember your name or try to guess your names. But with a smaller class size, we get more engagement and activities flowing.
Thank you so much. You scared me for a second. I thought I've been giving out the wrong numbers to my presentation.
It's 20.
Actually, I think it's 26 is the cap. And we aim for 24, and it often ends up being around 20. It really varies. But the main point is that they're not big. They're not big classes.
Wonderful. So I'm going to direct my next question towards Michael. What are your favorite things about the Tufts MPH program, and what do you feel makes it unique or stand out?
Well, I think that this is an easy one, because the thing that you will recognize the moment you step on campus, or the moment you start talking to faculty, or the moment you start looking through what faculty are doing in their research, you will realize that everything that we do is geared towards essentially changing the world. That's what we're here to do. That's what we're here to teach you. And what I tell the students the first day in my class when they walk in is that what we're going to try to do is help you fulfill your dreams. You know, every one of you has a public health dream. That's why you're here. That's why you were accepted. And in these days, it's very hard for all of us to kind of imagine how we can achieve these dreams, because there's obviously so much opposition to public health, so many barriers. We're fighting so many, corporate lobbies and interest groups and political polarization. But the key thing is that public health offers a systematic approach and specific skills that enable us to overcome these barriers. I mentioned my research in tobacco earlier. We overcame the tobacco industry. And 20 or 30 years ago, the tobacco industry was like what the NRA is today. Everyone looked at the tobacco industry and said, there's no way we're gonna beat these guys, and yet we basically brought them down. I was part of a litigation against the tobacco industry in which we had a $145 billion verdict against the industry, the largest single verdict in the history of the world, basically. So there are specific skills, in terms of how to develop a program, how to do a needs assessment, how to develop a program, how to formulate policy, how to analyze policy, how to advocate for those programs and policies. There's really a kind of a step forward, straightforward set of skills. And with those skills, you're going to be able to overcome these barriers. And so what we're really trying to do is to allow you to fulfill your dreams by teaching the specific skills that are going to enable you to do that. And so that's, to me, that's what's unique about the program, is that you feel that from the moment you walk in, and you feel like you're a collective part of this effort to change the world, which greatly needs changing right now.
Thank you so much, Michael. All right, so my next question I am going to direct towards Wenhui. How have you seen students grow across their 2 years in the program?
This is another easy one, multiple ways. I feel like I just echo what Mike said earlier about students come here with dreams, and you can see so many people with different directions. Some of them say, I want to be a consultant. Some say I really want to organize community, like grassroots level activities to really promote the public health. So based on those different paths that passion they come with, I have observed all kinds of interesting ways that people get involved in public health, and I'm very pleased to also see them using the skills that that we discuss and we use in class.
Thank you. Thank you very much. All right. The next question that we have is for Susan. What is, so we've spoken a little bit about the applied learning experience at Points. What is it, and what is the process of obtaining one? So we actually have the Director of Career Services, Katie Donovan, who will be on our next panel. She'll be able to give some more insight on that as well.
Well, so I'll talk a little bit about the academic side of it, and I'll let Katie add more to it, because the ALE, Applied Learning Experience, we call it ALE, it rolls off the tongue for us. So pardon me if I start just saying ALE, is really something that we're very proud of in the program. It's very much a facilitated experience, in the sense that students in the first semester engage in a planning semester. And so they learn about what the requirements are for the ALE, and they start approaching potential precepting organizations and working with those organizations to develop a project. So unlike an internship where you start on day one and just do this and that and this and that and then finish, in the ALE, you really have worked in the first semester with your organization about some piece of work that you will complete for that organization using the skills from the program, that you'll have some ownership and mastery on the project. And then in the second semester is when you implement the project and you spend time at the organization. And the entire experience along the way is supported with class meetings that bring up various project relevant topics, and also provide students an opportunity to collectively troubleshoot some of the things that are coming up at their sites that are supposed to come up at the sites because they're good learning opportunities for thinking about, how do we really do this work in the kinds of organizations that are doing public health work. So I think, how do people find their ALEs? I will just say that there's a number of organizations that have worked with us consistently through the years, and folks who have been preceptors many times. And in fact, quite a number of our alumni then go on to be in positions where they're like, oh, I definitely want someone to do an ALE at my organization. And so are, very receptive to students. And so some organizations actually send sort of a description of a project that they want for an ALE to places that are, very good contacts, to places that students actually cold call themselves. And they're supported in that, in understanding what the projects are. So students really do a range of things in terms of how they find their ALE. They can say yes to something that exists already, or they can really find something themselves. I think the one other thing to add is that we have a global health focus. And so some students are interested in doing their ALEs in another country. And if that is the case, early on in the program, your very first semester, there's a faculty member, Alice Kang, who heads up our global health focus. And there's a few courses that you need to take to be ready to be able to do the global health focus. And there's a couple of meetings in the university for us to be ready to be able to send you overseas. And then there are a number of ongoing projects in Guatemala, in India, and I believe in Namibia are where our strongest relationships are, that students can, that we can really help you make those contacts. But students sometimes have a contact or an interest somewhere else, and we can also help you develop a site that you already have in mind for your ALE. So that's an opportunity as well, that people may go overseas for their ALE.
Wonderful. And the logistical point with the ALEs, make sure that if you are interested now, that you make your advisors aware, so that way they can start laying out that plan for you. Again, even if you change your mind, that's perfectly fine. But we need to know as soon as possible. So if that's something that seems interesting to you, make sure to go ahead and bring up that piece so we can assist you with that process. All right.
Well, and the interesting thing that happened, I'm sorry to interrupt you. The interesting thing that happened during COVID is that we had remote international ALEs. So people collaborated with organizations overseas, but did analytic pieces or did, other sorts of projects that didn't require them to actually be present. So that's not something that we had done in the past, but in the 2 years that we've all learned that Zoom actually works pretty well for an awful lot of stuff, even if it's kind of sometimes sad. It's actually opened up a lot of possibilities for ALEs that weren't there before, because we really do understand remote work now.
So one last question here, and for those who drop questions in the Q&A and chat, I did take those questions down so we can touch base on those during the mix and mingle. But we do have another panel right after this, so we want to make sure that we are considering everyone's time. So the last question I'm going to kind of throw to Michael and Wenhui. Like I said, so you can kind of fight over who gets in first. And you may have spoken to this a little bit already. What areas in public health are you and your colleagues passionate about at Tufts? And so we've got a little bit of that already. So we'll see what comes from this response.
Wenhui, I'm going to let you tackle it first, and
I was just about to say Mike goes first. I think a common theme that I have seen that being shared across all the colleagues is the social justice and health equity. I have seen that everyone's study has an element in that. Really, we're a department that really focus on health equity and find that important. Mike, do you want to add to it?
Yeah, I mean, I think that there's no question that there's so many different areas and topical areas that the faculty are working on and that we're interested in. But I think Wenhui is exactly right that the thing that ties all of us together is an underlying interest in social justice. You know, our view is that public health is social justice. You know, public health is the pursuit of social justice. In a sense, you could define it that way. And that's the thing that ties all of the faculty together. And just to give you an example, just with the people that you're looking at right now. So, you know, I do work in tobacco and alcohol and firearms, and Wenhui she does some work in tobacco, and she does some work in obesity and nutrition and other areas. But we're actually collaborating on a paper together that's looking at political ideology and health behavior. And so we're able to find a nexus between our two diverse areas of interest to come together and work together on really exploring what's going on now with political polarization and how is that affecting people's health. And, you know, we've seen that with COVID, and for the first time, you know, we're seeing where political polarization is actually affecting people's health in a absolutely profound way. And so that's what we're doing, and we're interested in. This is more than just looking at COVID or looking at any particular disease. It's really looking at the way we structure our society. It's looking at the democracy and the degeneration of democracy that's happened, and figuring out how can we restore that in order to bring health equity and, you know, social justice, racial justice, and equity in all other areas to the public.
I would say the other little piece of that too is, you know, we're all also researchers, and there's an element. I mean, there's a reason why our research is in public health, but the other piece of being a researcher, I think, is that you also have a very high level of curiosity. Why does that work? Could it be different? What's going on here? We really need to understand this if we're going to solve this problem. And so that kind of you know, being able to work in a field and work in a way that allows you to pursue those questions that you're curious about, because you know you're just looking at the world and you're thinking that's so odd. What's going on there? And so, I mean, that's the other side of ourselves that it's really a pleasure to bring students in with, and that students are, you know, ready to do that with us, because you, like us, are looking at the world and saying, what is that? And can I do something about that? And how would I? And how would other people? And so I think sort of that inquisitiveness and creativity is the other thing that's sort of an underlying passion in this field, and that you'll find in our faculty.
Well, thank you, everyone, for participating in this faculty panel. I know it came across to me, even though I'm not a student, the passion that our faculty have for public health and working with students. And every time I do something with faculty, I learn something new about what they're doing and what they're interested in. There's a big board near my office that has all the faculty members and their different projects and different areas of interest, and I find myself on occasion staring at it and just looking at the wealth of different things that everyone is doing. So